Okay, I'm going to start by assessing my medication administration record. This is for Millie Larsen, 1/1/1936. No known drug allergies. We're going to be giving furosemide 20 milligrams IV push every 12 hours. Administer over 2 minutes. Flush with 3 milliliters of normal saline before and after each dose. Now for edema and blood pressure. And then we're going to be giving insulin Lispro 10 units sub-Q with breakfast. And now for control of blood sugar. She has no known drug allergies. I'll perform hand hygiene. I'm going to make sure that I have the appropriate supplies. So I have my 2 medications. I have my IV flush, normal saline. I have tape and a marker so I can label. I have my insulin syringe. I have, which is labeled for units for insulin. I have a 3 milliliter syringe, and I have a 23 gauge needle so I can pull up the furosemide, and the insulin will be pulled up in the insulin syringe. I have my alcohol swabs. I have an extra one here in case. And then I have some gauze in case I need so, and my clean gloves, as well as my MAR. I am going to check my medications, make sure that I have the insulin Lispro. This is 100 units per ml. It is expiring on 10 of 2027. I'm going to check it with my MAR. I have insulin Lispro 10 units sub-Q. That's what I'll be pulling up. This is insulin Lispro 100 units per ml. This is for Millie Larsen, and for now, it is the right route, sub-Q. This is for subcutaneous insulin, and I'm going to check the furosemide, which is 20 milligrams IV push every 12 hours. Administer over 2 minutes and flush with 3 mLs of normal saline. This is also furosemide, 100 milligrams, 10 milligrams per ml. So I will be giving 2 mLs to equal 20 milligrams for IV or IM use. IV is what we'll be doing. This is to be given now. The expiration date is 10 of 29, which is good. I will then start pulling up my medications. I will wipe the tops off of both with alcohol. I'll pull up the insulin first. I need 10 units. I'm going to pull up 10 units of air equally for what I'm going to be giving. I have the insulin Lispro. I'm going to inject the air. And then I'm going to pull up the 10 units that I need to give the patient, making sure that there's no air bubbles. None are in there. Put this back down, take it out. To recap the needle, I'm going to push it into the cap and then make sure the cap is on. I will label this now that it's a medication in a syringe that is not in a labeled vial. And then I'm going to do the same thing. I have my needle to pull up. I have a 3 milliliter syringe because I have to pull up 2 milliliters to equal the 20 milligrams. I am not going to touch the end of this, nor am I going to touch the end of the needle. Okay, this can go. We're going to pull up 2 milliliters of air. I'm going to inject into the vial, and then I'm going to pull up 2 milliliters of the furosemide. Make sure I have no air bubbles. Sorry, make sure I have no air bubbles. Back down, take it out. Engage safety. I'm going to label again for the reason being that it is no longer in a labeled vial. Now I'm going to do my second check. I'm going to make sure that I have Millie Larsen's medication administration record. This is who I'm getting the medication for. Date of birth 1/1/1936. The drug is furosemide. We have 20 milligrams, which is 2 milliliters, going for IV push every 12 hours over 2 minutes with 3 milliliters normal saline before and after flushed. And then I'm going to make sure that the time is for now. And then I'm going to do insulin Lispro 10 units sub-Q with breakfast now. I have it for Millie Larsen 1/1/1936, and we're going to be giving it subcutaneously 10 units. First, I'll do the I'll walk into Millie's room. I'm going to perform hand hygiene and say, "Hello, Millie. I'm Kelsey. I'll be your nurse today. Can you give me your name and date of birth?" Millie Larsen, 1/1/1936. Do you have any allergies, Millie? No known allergies. Perfect. I am going to be giving you an injection in your abdomen for your blood sugar control, and then I'm going to be giving you a medication through your IV line, and I will be doing that, which is in your arm. Do you have any questions or concerns at all? No? Okay, now I'm going to do my last check bedside. I have furosemide, 2 milliliters, which is 20 milligrams, IV push every 12 hours, administer over 2 minutes, flush with 3 milliliters of normal saline before and after the dose, which I have right here. I have insulin Lispro 10 units subcutaneous, and that will be with breakfast now. For the blood sugar, I have these for Millie Larsen, 1/1/1936, no known allergies. For this, I'm going to put my clean gloves on. And for the subcutaneous injection, I'll be using the abdomen, making sure that I am 2 inches away from the umbilicus. I will use an alcohol swab. 2 inches away, circular motions, letting that dry. I can leave this here to point to the injection site if necessary. You also don't need to. I am going to remove the cap. Hold this with my dominant hand with my thumb and index finger. And then with my non-dominant hand, I am going to pinch the skin together. I'm going to inject at a 45 to 90 degree angle. I am going to then push in the 10 units, take it out, and then engage safety. I'll put that in my sharp spin, and then I can blot if necessary. Millie does not seem to be bleeding. And then I will do my IV. Millie, I'm going to check your name band here. Perfect. Millie Larsen, 1/1/1936. And then I am going to get my alcohol swab, cleaning for 15 seconds. All right, make sure that it is now going to be unclamped. I am going to give my 3 milliliters of normal saline. I'm going to aspirate back to make sure that there's blood return, and then I'm going to give 3 milliliters of the normal saline. Making sure she is unclamped before I do so. Okay. Remove the needle. I am going to give this medication, which is the 2 milliliters of furosemide, 20 milligrams. I'm going to be giving this over 2 minutes. Every time I'm pushing through, I'm going to give a slow increment, small increment, slowly. And I'm going to assess the site, make sure there is no reaction, infiltration. I'm going to make sure Millie has no pain, no discomfort, and we'll do this over 2 minutes. Okay, so over 2 minutes, this is how long we would be doing this injection. It'd be 2 milliliters, 20 milligrams IV push over 2 minutes. I am going to take this now off, put this in my sharps container. I'm going to take my second saline syringe. I'm going to attach it, and I am then going to push the 3 milliliters of saline flush through the patient. That's all set. Removing that, I'm going to make sure Millie has no pain, no discomfort. She's in the spot that she would like to be in for comfortable measures. I am going to make sure she has her call bell and everything else that's necessary. Make sure all the IV lines are out of the way. And then I am going to perform hand hygiene, taking my gloves off. Hand hygiene. Document on my MAR, Millie Larsen, 1/1/1936, no known drug allergies. We gave furosemide 20 milligrams IV push over 2 minutes with 3 milliliters of normal saline before and after the dose now, so I will sign that. And then I gave insulin Lispro 10 units subcutaneously with breakfast now, and I will sign given for that. And then I will be all done.